Hi, I'm Dawn Sim. I work at Moorfields Eye Hospital as a consultant ophthalmologist. I'm also the director of telemedicine there and the clinical lead for our digital clinical laboratory. I think with diabetes, the first and foremost, you need to be seen by the right person in the right place in the right time. And telemedicine is just one of the ways in which we can assess how you're doing from the comfort of wherever you're located at your convenience. And I think it's terrible that patients have to wait 3-4 hours in a hospital to have them being told, oh, you're fine, come back next year. It's almost a deterrent for coming to hospital. But if you can pop down to your local opticians or actually do something on your phone or a test that you can do at your leisure on a train, and then that will be able to, we could titrate how often you need to actually come into a hospital to have your eyes checked. And I think in a young person's life, whether you're young or old, the last thing you want to do is spend 3 or 4 hours waiting around. A brighter future is an interesting thing, and that's different for everyone. I think every person, whether they have diabetes or not, wants to be able to see, to live freely, to spend time with people they love, and to be in control. So I think for diabetes in particular, I want patients to have control over how they can manage their eye condition. And that can be at any point of disease. You could come to me when you have nothing wrong with your eye, but you should have information that allows you to bring that away with you wherever you live and communicate that to other healthcare professionals. If you had a more severe spectrum of disease and you have to come in every month, every 2 months, every 3 months for treatment, I want in that intermediate period where you're not sitting in my office and we're having a chat, I want you to know exactly how you are doing. So how can technology, how can better communication allow that? I think that, with the advent of applications that you can have on your phone, with the availability of eye scanning devices on the high street, that is very doable, very achievable. So I think the future is brighter if patients have better control about how their eye disease is managed.